about research methods, biostatistics, and epidemiology. This is going to be the introduction. And as you can see, this course is divided into three components. There is the research methods, there is the biostatistics, and there is epidemiology. So this is on epidemiology. So we're going to describe what epidemiology is, define some terms, and then outline the scope and the objectives, and then the broad classification. The first thing we need to understand is when we're talking about these three courses, research methods, biostatistics, and epidemiology, when you want to carry out a research, it can be an academic research or in whatsoever sphere. Number one, there are some tools that we use that are going to help you in making a proper research so that you can use those findings to be able to deduce something about a certain subject matter. Now, specifically because this is health, we are going to have a research, and at the end we've gathered some information that is going to help us to make a conclusion that is going to help in making a health decision, a decision that is going to help us making policy on how we are going to be able to make to guide the health system, right? So biostatistics is the application of statistical methods to biological and medical data. So in biostatistics, actually, we're going to be talking about things like statistics, the means, the standard deviations. And the reason as to why you're even finding out about all of this is you want to use them in order for you to apply that statistical knowledge to biological data. Biological is living, right? For example, you find out about, let's say you carry out a research, you have got a population of 1,000 people, but you can't get everyone from that population, right? And so let's say you get 50 people and you want to make a conclusion using those 50 people about a certain condition that is affecting them. If we say that over 90% of the population is affected by the disease, it is not because we went to each and every person in the population, but we got a sample of the population and then made a conclusion. So that is about biostatistics. Epidemiology is the distribution and determinants of health and disease within a population. So, for example, you say, okay, we have got malaria. So, you're going to tell yourself, where is malaria more prevalent? And you'll be told, okay, in these areas, for example, currently Lusaka is one of those few places in Zambia which is more malaria free because our vectors here, the mosquito, doesn't have. But of course, if someone has traveled to another area out of Lusaka and they come here, they can come with malaria. And we can talk about things like, for example, trypanosomes. If you go to, let's say, the Kafue National Park, someone can have trypanosomiasis from there. Why? Because it is the area itself that has got the parasite. So epidemiology, we are talking about the distribution. Where is this condition? And what are the determinants of health? Okay, in this area, the water is not so clean. So these are the things, these are the diseases that you expect in the area. All right. And then so both the biostatistics and epidemiology is going to help us in getting to uh, collect data, analyze data, interpret data, and then make them closely intertwined in order for us to be able to deduce what determines health in that area. So it is important for you to understand both epidemiology and biostatistics. Now you're actually going to use biostatistics and epidemiology in this research method. So research methods, these are ways by which you are going to be able to carry out a research. For example, you can get just a group of people, all right, that is going to be known as a randomized trial. Or you can come in a class and then you start pointing people. Okay, you come, you come, you come. That is not random. You are simply picking. Okay, so those are methods by which you can carry out a research. So health, because when I'm talking about these epidemiology research methods and biostatistics, and this is interest in health, so you need to understand what health is. Health is a state of complete physical, mental, social well-being, and not merely the absence of disease. So some people are not sick physically, but then their mental status is not fine. You are always in heartbreaks, you can't connect with people. you have got bad relationships with people. Everyone that you meet, you're always arguing with them, right? Or something like that. So that isn't health at all. So healthy is complete physical, mental, and social well-being, besides just not having disease. Okay? That is according to the World Health Organization 1948. Now, public health is an effort organized by society to protect, promote, and restore the health of the population. That is, it's the it's public health. We are talking about the public, right? Now, this is important for every sphere of health to understand whether a medical student or a medical doctor, a public health practitioner, a nurse or a nursing student, or anyone that is going to work in the health sector. It is important for them to understand public health because it's an effort by the society to be able to protect themselves, to promote and to restore the health of the population. When you talk about the disciplines of medicine, now it says specifically for medicine, of course, medicine is not just a doctor, right? There are many people that are practicing medicine. So when you're studying medicine, nursing, health sciences, you have got the basic sciences. And these are going to be little for those who are doing the actual public health and more for those that are doing the the health sciences and the medical sciences. So you are going to have anatomy, physiology, pathology, pharmacology. Those courses we call them basic sciences. They're going to help you to build up so that you can be able to practice the medicine well. And then you are going to have clinical sciences. These are the ones that now you'll be doing on the ward. For example, obstetrics, pediatrics, you have got internal medicine, you have got surgery. These are concerned with the care of individual patients. You'll be interacting now with the patient. Public health is community, where the community replaces the individual. Your interest is on the community. We want the entire community to be fine. We don't want anyone to be sick. So that is public health. What is the background of epidemiology? So epidemiology is going to draw upon the medical, biological, behavioral sciences. In other words, in epidemiology, you want to understand anthropology. An arthropod is a vector. These are insects or anything that is going to carry a microorganism that is going to cause disease. For example, malaria is sorry, not malaria, but the mosquito is an arthropod. It is a vector. It carries the plasmodium parasite. You have got a fly that carries also what we call a trypanosome, which is a parasite that is going to cause trypanosomiasis, which we call in Africa as sleeping sickness. In America, it causes Chagas disease. So we can study health and disease by observing the effect on individual, laboratory investigations of experimental animals, and measuring the distribution of health problems in the population. The distribution, okay, where is this problem more? Okay, this problem is more in the south, it is more in the north, and such. Okay, so we can study health and disease by observing individuals again, laboratory investigations, and measuring the distribution of the disease. Now, epidemiology comes from Greek. Epi means upon, demos means people. Okay, so it is actually from this that we get the word epidemic, upon the people. And then logos is a start. Remember, epi upon, demos people. So epidemic is upon the people, something that has befallen the people. And then logos is study. So epidemiologists are concerned with investigation, control, and prevention of an epidemic. So here we actually have some important terms to understand. We have got a pandemic, an epidemic. Okay. So when we say something is a pandemic, let's start with what we call endemic. Endemic is a disease that is always there in the society. For example, we're always having some normal cases of cholera, right? Now, let me not talk about cholera because it's more not too normal. Let's say malaria. There are always these normal cases that we expect. That's it, something normal, endemic. Now, when the cases rise a bit above normal, it becomes an epidemic within a localized area. And then when these cases now cross borders, you hear them, no, it is not only in Zambia, also in South Africa, also in Namibia. That becomes a pandemic. A pandemic is now a global concern. All right. So, two basic assumptions about disease. Every time you are studying disease, we take two assumptions. Disease does not occur at random. Everyone that has got a disease, it means that there's something that has caused it. It can't be random. There is something that changed, whether in their body or in their environment. Another thing is that disease has a causal and preventive factor. Though they seem to be the same, please take note that there are two basic assumptions about disease. Disease does not occur at random, and disease has causal and preventive factors. So, since disease doesn't occur at random, it means that there's something causing it, isn't it? Because you know what is causing it, it means that you can prevent it. So, those causal factors actually going to be also helping you to understand how you can prevent such a disease. So, epidemiology, therefore, is a study of the distribution and determinants of health, related states and events in specific population, and the application of the study to control the health problem. It's not a matter of mastering what is here. Or what we are saying is that in epidemiology, what you want to understand is the distribution. Where is the disease more? And the determinants of health. Okay, what are the things that determine health in this area? And also to apply. Actually, you are looking at a specific population, and now the application of the study to control health problems. That is important. Okay. So, epidemiology again, we have got disease and population. Disease, if we say this is a disease, it is just a deviation from physical, mental, emotional health, okay, to include conditions such as injury, birth defects, health outcomes. So anything that deviates from the normal physical, mental, or emotional state is a disease. Is a disease. Hope you get that it's not only physical, mental, and emotional. Population is a group of people that have been confined in a same geographic location. If we say distribution, distribution is the characterization, okay, characterizing the distribution of health status in terms of age, gender, and race. So if we say, okay, this disease is distributed in this way, what we mean is who, what age is affected, what gender is affected, which area is affected, which kind of people, which race is affected, okay, or which social status is affected. The rich, most of the diseases are actually happening. We have got the diseases of the rich and the diseases of the poor. So that's distribution. Okay, all those things are falling under distribution. And then we have got determinants. So determinant is any factor that brings about a change in health condition or other defined outcome. Those are health determinants. Any factor that brings about a change in health condition. Okay, for example, if you have got poor water or not clean water, that can be a factor that can bring about a change in health outcome. Maybe poor health hygiene. So those are factors that are going to change these health outcomes. Okay. So when it comes to, remember I've said epidemiology is a study of the distribution and determinants of disease. So if we look at the definition itself, we have got study. So how do you study disease and the distribution? You can use surveillance, you can observe, you can make, you can also do what is known as hypothesis testing. You understand this much later because there are actually also some equations we'll get to bring in. And you can also do experiments just to be able to study how diseases are distributed. Distribution itself refers to the analysis of time, person, place, and classes of people already mentioned to say, okay, this kind of people can have the disease more than another kind. So that's distribution. And then determinants, these are things that brings about change in health. Okay, they include biological, chemical, physical, social, cultural, economic, genetic, and behavioral things. All this can bring about a change in health. And then we have got health related states and events. So health related states and events refer to disease, causes of death, behaviors such as the use of tobacco, positive health status, reactions. So all these health related states, they are the ones that we'll be able to study in epidemiology. Okay. So determinants of disease occurrence includes both causes and factors that influence the risk of disease. Remember the determinants of disease, these are just things that will be able to cause a deviation from the normal, isn't it? So disease that we said doesn't happen at random. Disease is actually because of three things. We call them the epidemiological triad. We have got the agent, the host, and the environment. I want you to understand this. Sometimes someone can just feel nice in that test or exam. They just say, describe the epidemiological triad, and you have to write 20 marks. I've written a test before with that question. So disease is going to happen because of the interaction of three things: the agent, the host, and the environment. Because infections does not occur at random. Infection is only going to occur when the agent is encountered. The agent is that thing that is that is able to cause disease. For example, plasmodium parasite carried by the mosquito is the agent. Actually, mosquito is going to be the agent. It is the one that is carrying the plasmodium parasite that can cause disease. But in this case, the plasmodium is the agent because the one that is going to cause disease. So we first interact with the agent, or we encounter the agent, and the agent, even if you encounter it, not everyone is going to get sick. Only susceptible hosts. For example, let's say uh, I can give another example. Let's say HPV, the one that causes cervical cancer. So a lady, not every lady that has got gets HPV from a man, because most men have got the HPV, but even when they're sleeping around with ladies, the ladies are not going to have cervical cancer. Why? Because it's not only the agent that is needed, you also need a susceptible host. So that lady, if a lady is going to have cervical cancer, number one, they should be young. Okay, they should be young. Number two, the more the children they have, the more the chances of them having cervical cancer. Number three, they should be promiscuous, like sleeping around with many men. Number four, at least a lot of pregnancies or a lot of births. So this one is a susceptible host. They have got some factors that are good enough for the agent to survive. So the host plays an important role. Now, besides that, the environment should also be favorable. The HPV should find a good environment in which it should be able to grow for it to cause disease. All right. So that is it. Remember, we said the basic assumption about disease is that disease does not occur at random, and disease has causal and preventive factors. Okay, it results from the interaction of the host, which is a person, the agent, which is the bacteria or maybe the virus, and the environment. Let's say, for example, for malaria, there is the contaminated water there where this thing can be able to grow, right? So this is the epidemiological triad. Disease is a result of forces within a dynamic system consisting of the agent, the host, and the environment. These all should agree for you to have disease. Otherwise, you are not going to have disease. So when you look at the agent has got some things that makes it to be able to cause disease. All right. Number one, infectivity, the ability to spread the disease. Infectivity. So disease can actually spread from another person to the other person because the agent has got that capacity. And then there's pathogenicity. Pathogenicity is the ability of the agent to cause changes in the body. That is pathogenicity. For example, say, the HPV virus, so I've got what we call high risk HPV, HPV 16, HPV 18, 31, 35. 33. These are high risk. Once you get this HPV, what happens is that it is going to go on what we call the squamocolumnar junction, the junction on which the endocervix changes into the ectocervix. Endocervix has got columnar epithelium, ectocervix has got simple squamous non-keratinized epithelium. So at that point where the epithelium is changing, what happens is that this gamma guy, the HPV, is going to feel nice, and then it is going to cause metaplasia, or actually it causes dysplasia, abnormal division of cells. And as these cells are abnormally dividing, that process is known as pathogenicity. Right? And then virulence. Virulence is the ability of the organism to cause infection. So actually, each organism has got what we call virulent factors. The same HPV has got some proteins. It has got what we call the E6, E7 proteins, the L1 and L2. These guys are actually going to help this HPV virus to be able to attach, to be able to arrest, actually to cause problems in the cell cycle, so that there's abnormal division of cells. That is virulence. And then immunogenicity. So immunogenicity is the ability of this guy to cause the body to respond. Okay. So if the body responds, actually, you know that what causes death majority of the times is the response of our bodies to the disease and not the disease itself. Because the immune system is going to give a very bad response in such a way that we cannot contain it. And because we can't contain it, what happens is that we end up dying. For example, there's going to be release of a very large amount of cytokines, and these cytokines cause a fever. They end up causing changes in normal homeostasis, and the body can't contain that, and that leads to death. Of course, there's also the need for survival. So the agent, if it comes in the body, it needs to survive. For example, you know, majority of the things that enter our bodies through the mouth, at least our GIT protects us because we have got hydrochloric acid there. The acid acts as a barrier. But what happens that a lot of bacteria can withstand the acid that is in the stomach. So the agent, the ability of the agent to survive the conditions in the body actually allows for disease to happen. Okay, and then antigenic stability. So the antigen is basically the protein of which are found on the surface of that disease causing microorganism. And actually, when we are testing to see if someone has got a disease, for example, if someone has got HIV, we can look at some antigens. We can look at the proteins that surround this HIV. For example, the HIV has got a protein which is known as P24. We have to look at this P24. If we identify it, we'll know that, okay, this one has got HIV because P24 is found on HIV. So that is used for diagnosis. But the antigenic stability, if the antigen is more stable, it means that you can destroy it. And so what happens is that you can't destroy that microorganism and it can cause infection. When it comes to the host, the age of the host is important. For example, the young have got underdeveloped immune system. The old, their immune system is failing. So they have got a much higher ability to develop these diseases. All right. And then when you look at sex, there are some conditions that are more prevalent in females than in males, and the other way. For example, we both have breasts as males and females, but females are more likely to develop breast cancer than males, right? And why is that? It's because of estrogen. Estrogen is higher in females, so that estrogen is going to be bad. That is why for a female that has had a lot of pregnancies is protected from breast cancer. But the problem is that she has got a higher risk for cervical cancer. You see the problem. So anyway, sex is a determinant. And then genotype. Just the genetic makeup also predisposes you to having uh, s- getting the disease than another one. Also behavior. Okay, behavior. This of course might fall also in, might also maybe include the kind of interactions that you have. For example, one likes going, let's say, biking or diving, or let's say driving. They are more likely to be involved, let's say, maybe in an accident because of careless driving. And for that accident that has happened, the microorganism has got more chance to enter the body when there is, if there is trauma, if there is a place that has been cut, and that actually is going to cause disease to happen. Nutritional status. For example, some people are malnutritioned. They don't eat well. Because of that, they are prone to some conditions. Okay. The environment is also very important, like the weather. For example, a cold or a flu is going to be more common in cold weathers than in hot weathers. The housing that you live in also, you are looking at ventilation. How well is the ventilation? You have got asthma, and then you've closed all the windows in your room, and there is not enough air, so you are more likely to have problems there. The geography, like just the area in which you are, some areas are better for some conditions or for some microorganisms to survive than others. For example, in East Africa, when you look at the trypanosomes, we have got what we call the Trypanosomia brucei gambiense and Trypanosomia brucei rhodiense. Rhodiense is more in East Africa, causing the East African trypanosomiasis, and then Trypanosomia brucei Gambiesi is more on the west, causing West African trypanosomiasis. We also have what we call Trypanosomia cruzi, which is more in the American, causing what is known as South American trypanosomiasis, also known as Chagas disease. So just the geography tells you of some conditions. Occupational also. Occupation, like the work that you do. For example, people that work on the mines, they are exposed, let's say, for example, to asbestos, silica. So they are more likely going to have these lung complications, right? Than someone who doesn't work there. Someone that is always working with lifting cement, they are in this room that has got cement. Well, they are going to suffer some respiratory conditions that someone will not be able to suffer that doesn't work with cement. And also air quality. Some environments, as we've said, your place, there is a lot of smoke. Maybe you work in an industry. So that can help some microorganisms to be able to thrive, or for the disease to happen, and also the food that we get to eat. So that is epidemiological triad. Now the distribution of disease, when you're talking about the distribution of disease, it's the frequencies or values or categories of measurements with respect to time, place, and person. That's a distribution. And you are not only looking at the place where the disease is found, but also the persons that are affected and the time period when people are affected, maybe in the morning or maybe in the summer or in the winter, right? Frequency involves measuring this disease distribution, how frequent the disease is happening, and requires information. For example, count the size of the population, the time period for you to tell the frequency, how often is this disease happening. And it requires mathematical calculations of what we call the ratio, the proportion, and the rate. We'll discuss these guys in biostatistics more. Okay. Now, when you are classifying epidemiology, you classify it into two main categories. You have got descriptive epidemiology and analytic epidemiology. So, descriptive, this is the study of the frequency and distribution of health related state within a population by person, place, and time. It is descriptive. You're trying to describe. So, you are looking at how often does a condition happen and how is this condition distributed. Okay. So that is descriptive epidemiology. In analytical epidemiology, it is a more focused study of health-related problems or reasons for relatively high or low frequency in specific groups. So descriptive, you are simply saying, okay, what condition, how are conditions distributed? Okay, this condition is here, this condition is here. It is more in this season, it is more in this place, it is more in this given time. But analytic is more focused. Now you are saying, how high is this condition in this specific group? Let's say, for example, you said, okay, this condition is more in the rich than in the poor. And then you ask yourself, how high is it in the rich? How low is it in the poor? That is analytic. You are being analytical, right? Okay. So some questions that you ask yourself, epidemiological questions. For example, to describe the occurrence of a disease fully, you can ask yourself some questions. For example, what health events are occurring? Who is affected? When do the cases occur? Where do the cases occur? This is to describe the occurrence. Other questions is, why is this condition occurring and how can it be influenced? Okay. So another thing to understand is What is the use of epidemiology? Histological study in community health getting better. So the reason as to why you want to follow up disease and you want to answer questions, for example, where is the disease more found? What are the conditions that, for example, which people are affected, which time period is? You want to see over the years. For example, in 1990, these are the people that were affected in this area, in this given period. In this year, 2025, who are the people affected? In which area? Which period of time? You understanding that will help you to be able to tell if the condition is becoming better or worse. All right? That is important. And then also, epidemiology is going to help in community diagnosis to tell what conditions are more in the community and what conditions are less. And also working of health services. So actually, when you get to study the conditions and when they occur, how their distribution, they are going to help you in also getting to see the availability, accessibility, utilization, effectiveness, efficacy, and efficiency of health services. Okay, if you see a condition is more prevalent, it is going to tell you, okay, there should be maybe a problem with accessibility to maybe some medicines. So that is going to help you to tell how well health services are being supplied. And it can also help in individual risk and chance of getting the disease. So if you see, okay, this disease is more prominent in this area, for example, the University Teaching Hospital in Zambia, UTH, hepatitis B is one of the things that you want to look out for. So if you are working in there, you need to make sure that you are vaccinated against hepatitis B. Because if not, you have got a higher chance of getting the hepatitis. Instead of you being the doctor, you end up being the patient later on. Okay, and it also helps in clinical decision making, which involves the use of decision tree. If you know how the disease is distributed, you know, okay, this is the best decision we can make. Give this amount of money to this area because they need to cater for this disease. Okay, so specific objectives when it comes to epidemiology, what do you want to understand when it comes to epidemiology? You want to identify the cause of the disease and the risk factors. For example, what are the risk factors of breast cancer? Having a few children, right? That's a risk factor. Okay, having a lot of estrogen, for example, after menopause, people are given some estrogen medications to help them because estrogen is important for strong bone. If you don't have estrogen, you are going to develop osteoporosis. So that actually can end up causing uh, the condition breast cancer. So you, in epidemiology, are also interested in finding out the risk factors. Okay, why is it that in this area you have got this condition more than in the other area? And also determine the extent of the disease found in the community. How bad is the disease in this community? And to study the natural history and prognosis. The natural history is how prognosis is how well is this disease responding maybe to the interventions in the community. Okay, because we've been following up this disease for long. 1990, 20 people were affected. In 2015, 19 people were affected. In 2020, 50 people are affected. You can tell that, okay, the disease burden is increasing. Okay, and then the prognosis is bad, like the disease is worsening. And also to evaluate new preventive and therapeutic measures. So you want to see, okay, maybe the drugs we are using are not good. Maybe we're not doing enough. What more can we do? So epidemiology is actually a scientific tool in order for us to describe, to understand, to propose, and test hypotheses. For example, they've given you to say, okay, we think this condition is because of this. We think this condition is happening because in this area there is this. For you to confirm that that thought is true, you get to carry out a study, and that's epidemiology, and also to validate or challenge public policy. Okay, they've told you that this is the medicine, for example, this is the medicine that we use for this condition, but after you doing a study you discover that that medicine is not helping. So epidemiology is going to help you to validate or to challenge, no, actually this policy is not right, you need to remove it. That's why in medicine, in the health sector, policies are always changing. The book that you used to use in 1990 is not the book that you use now. Why? Because policies have changed. In the 1990s, if someone has got HIV, it's a death sentence. But right now, they will live a normal life. They can have even children that are not HIV positive. Okay. So for now, that is going to be a good introduction to epidemiology, and that is where we're going to end. Thank you so much for being present till now. We'll continue in the next class with the course.